Welcome back to KUT Podcast. Let's recap our last episode, Understanding Prostate Cancer. This episode provided a brief overview of prostate cancer and how it affects people. It also emphasized the importance of early detection, covering key symptoms, risk factors, and the role of lifestyle and genetics. In our next series, we will be discussing detection and diagnosis, covering different screening methods such as PSA tests and the importance of regular checkups, especially for men over 50 or those with a family history of prostate cancer. Why screen for prostate cancer? Explain that prostate cancer is one of the most common cancers among men, yet it often shows no symptoms in its early stages. Early detection through screening can help catch it before it spreads, providing a better chance for effective treatment and reducing the risk of serious complications. PSA test, prostate-specific antigen test. What is PSA? PSA is a protein produced by the prostate gland that helps liquefy semen. It's normally found in the blood at low levels. How the PSA test works. A blood test measures the amount of PSA in the bloodstream. Typically, low PSA levels are normal, but high levels may indicate that something is wrong with the prostate, which could be cancer or other conditions like prostatitis, prostate inflammation, or BPH, benign prostatic hyperplasia. Interpreting PSA levels. Normal range. PSA levels below 4 nanograms per milliliter, are often considered within a normal range, though levels can vary by age. Elevated PSA levels above 4 nanograms per milliliter may raise concern, but this is not a definitive cancer diagnosis. Doctors may consider PSA levels between 4 and 10 nanograms per milliliter as a gray zone, while levels above 10 nanograms per milliliter increase suspicion for prostate cancer. Factors affecting PSA levels. Age, race, and family history can all impact PSA levels. For instance, African American men and those with a family history of prostate cancer may have naturally higher PSA levels. Advantages and limitations. While the PSA test can detect prostate changes early, false positives, elevated PSA without cancer, and false negatives, normal PSA but with cancer, are possible. It's not cancer specific but helps indicate whether further tests are needed. Digital rectal exam, DRE. What is the DRE? In this exam, a healthcare provider inserts a gloved, lubricated finger into the rectum to feel the prostate through the rectal wall. It is quick, usually taking only a few minutes. What doctors feel for. Doctors assess for abnormalities like lumps, hardness, or irregularities in the prostate's texture, which could signal a problem. Advantages and limitations. The DRE can detect abnormalities in the prostate that may not be apparent in PSA levels, offering an additional layer of screening. However, it only evaluates part of the prostate, so some cancers may be missed. Advanced diagnostic tools. MRI, magnetic resonance imaging. Purpose of MRI in prostate cancer. MRI is used if initial tests suggest cancer or as a way to better examine the prostate before a biopsy. It provides high-resolution images that show the prostate structure and can highlight any suspicious areas. What MRI reveals. MRI can help detect tumors, determine their size, and assess if they have spread outside the prostate. Guiding biopsies. MRI results can guide doctors to take tissue samples from specific areas of the prostate during a biopsy. Transrectal ultrasound, TRUS. How TRUS works. An ultrasound probe is inserted into the rectum, producing images of the prostate to help locate abnormalities. This is often combined with a biopsy. Role in diagnosis. TRUS allows doctors to visualize the prostate and guide biopsy needles to specific areas, making sampling more accurate. Prostate biopsy. What is a biopsy? If screenings and imaging suggest cancer, a biopsy confirms the diagnosis. Using a thin needle, small tissue samples are taken from the prostate, often with ultrasound guidance. How samples are examined. Pathologists examine the tissue under a microscope to look for cancer cells. A Gleason score, based on how much the cancer cells resemble normal prostate cells, indicates how aggressive the cancer is. Understanding Gleason score. Scores range from 6 to 10, with higher scores indicating more aggressive cancers. This score helps guide treatment options and predict the cancer's behavior. Risks and recovery. Common side effects include temporary blood in the urine or semen. Though minor, these effects usually resolve within days. Significance of regular checkups. Screening guidelines. For men of average risk, doctors often recommend discussing PSA screening around age 50. For those with higher risk factors, such as a family history or African American ethnicity, screening may start earlier, around 40 to 45. Why routine checkups matter. Regular screenings can track changes in PSA levels and prostate health, especially if the initial tests were inconclusive or in a gray zone. This allows for early action if signs of cancer emerge later. Interpreting results and next steps. What PSA or DRE results could mean. Normal results. Regular follow-ups may still be recommended, especially if you're in a high-risk group. Abnormal results. Further tests, like MRI or biopsy, can confirm or rule out cancer. Post-diagnosis options. If cancer is confirmed, your doctor will discuss the stage of the cancer, options for treatment, and the need for additional imaging to check if the cancer has spread. Surveillance and treatment. In early-stage, low-risk cases, doctors may suggest active surveillance, closely monitoring the cancer rather than immediate treatment. More aggressive cancers might require treatments like surgery, radiation, or hormone therapy. These tests are tools, each providing valuable insights into prostate health. Proactive screenings can help detect cancer early when it's most treatable, giving men the best chance for positive outcomes. Reinforce that understanding these methods empowers individuals to make informed choices about their health. Thank you for joining us as we explored the vital steps of detection and diagnosis for prostate cancer. Knowing what to expect and understanding the tools available for early detection can make all the difference in managing prostate health. Remember, regular checkups and being proactive can catch issues early when they're most treatable. In our next series, we'll dive into the various treatment options available for prostate cancer, covering everything from active surveillance for low-risk cases to surgery, radiation, and hormone therapy for more aggressive forms. We'll discuss what each treatment involves, who it's best suited for, and the potential outcomes. Whether you're facing treatment decisions yourself or supporting someone who is, this episode will give you the insights you need. Thanks for listening, and we look forward to continuing this important conversation with you.